let's talk about something really important. One of the most critical and, let's be honest, one of the most intimidating parts of caring for someone with ALS, their respiratory care. This is one of those areas where having clear, practical information is absolutely everything. So let's dive right in. And right off the bat, I want to say this. If you're feeling anxious about breathing changes or just what comes next, that is completely 100% normal. You are not alone in feeling that way. It's a totally valid response.
So here's our promise to you for the next few minutes. We're going to take all that uncertainty and turn it into confidence. Our goal is to give you the practical know-how you need to handle this, day in and day out.
All right, so to really get a handle on this, we've got to start with the why. Understanding what's actually happening in the body is the very first step toward feeling in control and managing things effectively. It really boils down to 3 key muscle groups. First, you've got the diaphragm. That's the big powerhouse muscle for breathing. As it gets weaker, breaths just become more shallow. Then there are the intercostal muscles, the ones around the rib cage. Their job is to expand the chest, and when they're weaker, the lungs can't fill up as much. And finally, the bulbar muscles in the throat. Weakness there makes it tough to swallow and, really importantly, to clear secretions. So you can see it's kind of like a triple whammy. Now, this is a really, really key point, and it's something a lot of people get mixed up. You'd think the main problem is not getting enough oxygen in, right? But with ALS, it's often the flip side of that coin. The body struggles to get carbon dioxide out, and it's this CO2 buildup that actually causes a lot of those early symptoms. So if that CO2 buildup is the real culprit, how do you spot it? Well, that brings us to the early signs. And I want you to think of this not as something to be anxious about, but as your first and most powerful tool. Knowledge really is power here. The tricky part is that these signs are super subtle at the beginning, and they almost always show up at night first. That CO2 buildup can lead to things like restless sleep, waking up a lot, or even those unexplained morning headaches. Then, as things progress, you might start noticing daytime signs like shortness of breath, getting tired really easily, or a cough that just sounds, weak. And this is why paying attention matters so much. This isn't about looking for problems. It's about taking action early on that makes a huge, direct impact on comfort and quality of life. Spotting these signs leads to better sleep, way less fatigue, and it really helps prevent those scary emergency situations down the line. Okay, so when you and the care team decide it's time for a little extra help, what does that actually look like? Let's get into the toolkit. And I really want you to see these not as scary medical devices, but as incredible support systems. You're allies in this. First up, and honestly, this is the big one, is non-invasive ventilation, usually called a BiPAP machine. It is an absolute game changer. It's a small machine that gently pushes pressurized air through a mask. It basically gives those tired breathing muscles a break, helping to get air in and, just as crucial, helping to push all that built-up CO2 out. Now, I'm not gonna lie, getting used to it can be a process. Patience is key. The number one thing is finding a comfortable mask. There are tons of different types, so work with your respiratory therapist to get the right fit. A great way to start is just by using it for short bits of time, like during a nap. It's all about a gradual approach and working together with your care team. All right, tool number 2, the cough assist. This thing is kinda brilliant. You see, as those cough muscles weaken, it gets really hard to clear out gunk from the lungs, and that can lead to infections. What this machine does is it gently pushes air in to fill the lungs, and then quickly pulls it out. It perfectly mimics a strong, productive cough. And look, beyond that machine, there are a few other key things for managing secretions. A simple suction machine can be a lifesaver for clearing the mouth. Staying hydrated is so important because it keeps mucus thin and easier to manage. And even just changing positions, using gravity to your advantage, can make a world of difference. It's all about having multiple tools in your belt. All right, we've got the why and we've got the what. So how do you actually make this work day to day? This is where we shift focus to creating a calm, predictable rhythm, a routine. Having a routine, something like this, just takes so much stress and guesswork out of the equation. It builds in those essential tasks, like using the cough assist in the morning and at night, and getting the BiPAP all set before bed. That predictability is incredibly calming and reassuring for both of you. And don't forget about this one. It's probably the simplest, most powerful tool you have, and it doesn't even have a power cord. Positioning.
Just by helping someone sit upright or making sure they're well supported in a recliner, you are maximizing how much their lungs can expand. Simply avoiding lying flat on the back can be one of the most effective things you do all day.
Okay, let's talk about the last piece of the puzzle. And honestly, it's the most important one, your team. And remembering that you are absolutely not alone in this. Think of an emergency plan not as preparing for disaster, but as giving yourself peace of mind. It's about being ready, which takes away so much of the fear. Have a go bag ready with a list of meds, equipment settings, and all your important contacts. And make sure everyone's clear on your loved one's wishes. And please, please remember this. You have a whole team of pros in your corner. Your neurologist, the lung doctor, the pulmonologist, and especially your respiratory therapist. They are your partners. Pepper them with questions. Call them when something changes. Ask them to show you how to use the equipment again and again until you feel like a pro. That is what they are there for.
Seriously, if there's just one thing you remember from everything we've talked about, let it be this right here. The single biggest mistake any caregiver can make is trying to shoulder this all by themselves. Lean on your team. Let friends and family help. You simply cannot pour from an empty cup.
I really want this to sink in. What you're doing, it's just so much more than a list of tasks. Every time you adjust a pillow or check a mask or help with a cough, you are helping someone breathe easier. You're providing comfort and safety. You're giving them peace. It's profound. And I'll leave you with this promise. I know it all feels like a lot right now. It's overwhelming. But with time and with practice, all the things that feel so intimidating today will become familiar. They will become your rhythm. You are going to build an instinct and a confidence that you probably can't even imagine right now. You've got this.